So the population I decided to talk about is older adults. How have your perceptions of older adults changed over the course of the nursing program? I've always had an affinity for taking care of older patients, but I feel like ever since starting this program, I've grown to enjoy it even more. I feel like oftentimes the older adult population is overlooked, whether it's through a couple stereotypes or even differing morals between younger age groups and older age groups. What healthcare issues do you feel are most important to address regarding care of your population of interest, and why are these issues important? Um, for any age group, constipation is a problem, but I think it's especially prevalent in the older adult population. This could be due to the medications that they're taking that just decrease their gastric motility. This could be due to the natural weakening of muscles over time, and even the decrease of mucus secretions as well, that just make it harder to pass a bowel movement. In my clinical experience, though, I've always seen with older patients that they may have standing orders of stool softeners or supplemental fibers that'll help soften the bowel movements. The risks that come with that are them working a little bit too well, and the patient's bowel movements might become a little bit too loose. I've seen that happen as well, and what results of that is the nurse just having to put in another order for another medicine that'll help make them not have diarrhea. Describe one change that you feel would benefit your population of interest. So I feel like a non-pharmacological intervention that will help older adults and anybody have bowel movements is implementing squatty potties, or at least little stools that allow for them to elevate their feet. Squatty potties simulate the body positioning of squatting while defecating, which is most natural for our bodies. In a lot of other countries, they may have toilets that are still in the ground, so people might have to squat to have a bowel movement or use the bathroom. But even before toilets were made, people would squat. And looking at the anatomy, whenever you elevate your feet or squat, it straightens out that anal canal and it allows for a smoother bowel movement. Overall, this aligns the body in a way that reduces strain on the bowels, which in turn reduces the risk of hemorrhoids, anal fissures, and stroke. As a nurse leader, how would you promote and implement your ideas? The squatty potty itself is a plastic stool that just wraps around the bottom of the toilet, so it's pretty easy to implement. As a nurse, all you have to do is really just put it in the room and instruct the patient how to use it. Because it's plastic, it's also easy to clean too, and it's easy to store as well. It's easy to store in the patient's room, and when it's not being used, it's easy to stack on top of other squatty potties or stools, and then you can stack those and store those in a supply closet. But yeah, for the team, implementing squatty potties is not difficult. It's just a matter of if they have the funding or the supplies to have the stools themselves. But I feel like if you don't have the stool, there's other ways to get the same effect of squatting. I read one source that said you could literally place a bedpan on the floor, squat over it, and use that. I guess. You could also get a stack of bricks and put it in front of the toilet and put your feet on top and elevate your feet with that. I don't know where you would get a stack of bricks, but basically anything you could use to elevate your feet while sitting on the toilet is still going to give that same effect. But I think overall, the best solution would have a stool that is made to be placed on the ground.